Hi, this is an interesting case from the emergency room with several findings of learning importance. It's an abdominal CT in a patient with abdominal pain. And as we are scrolling through the upper abdomen, the first thing that catches our eye is this large air collection anterior to the liver, which is continuous with this free fluid in the perihepatic space. So this is a large pneumoperitoneum, and we see additional small loculi of free air under the left diaphragm. And here's another telltale location for free air in the porta hepatis. You see that little tiny loculus over there as well, and here's another one. So these are all common locations for free intraperitoneal air that we must learn to look. Here's another one right in the gallbladder fossa, and one up under the edge of the liver, the left lobe of the liver. So when free intraperitoneal air is predominantly in the upper abdomen, as in this case, and we see that there isn't much as we scroll down, the thing we should think about is a duodenal origin of perforation, because the free air in the upper abdomen tends to come from proximal perforations more commonly. And so when we look at the duodenum, we see that there is significant thickening of its wall, which there's edema, mucosal edema, the margins are fuzzy. And on this particular image, if we look, another thing catches our eye, which is a high density rim around the left lobe of the liver. Now when we see this, it's a very telltale sign, and it's interesting because we see it on the left lobe of the liver, but we don't see it on the right lobe. And that's because this is a collection of extravasated oral contrast, and you can see it tracks all around the left hepatic lobe. This little pocket here as well. Now where is the source? We need to scroll down. We see that it's arising from the duodenum right here, this little track of contrast, a little outpouching of contrast in the wall of the duodenum, and that's an ulcer which has perforated into the perihepatic space, resulting in leakage of contrast and a large amount of free intraperitoneal air. So these are hallmarks of a duodenal perforation. The most obvious finding at the initial review is the free air, but then as we look more closely, we start to see contrast extravasation, and then when we look at the site of perforation, we find telltale signs of bowel wall thickening, fat stranding, and ultimately the focus of perforation, which is this little ulcer that has leaked into the perihepatic space. So perforated duodenal ulcer.